Good morning, pre-PT Nation. This is a tip request from one of our followers asking about what types of settings can I get observation hours in. This is a great question, and we are in our PTCAS dummy account that we always keep open here. And we're going to go to the observation hours verification form to actually give us some more information about the different types of settings that we can observe in. So if we scroll down, we're not looking here so much at this information here. Then you can have the settings and the hours of experience. Okay, so there's two main settings that you can observe in, kind of general categories. You have inpatient versus outpatient. Inpatient physical therapy is when a patient is going to be staying at that location overnight. Outpatient is the patient is coming and going. They come to an appointment, they get their treatment, and then they leave, and they don't stay overnight. Okay, so if we look in inpatient facilities, you've got acute care hospital, nursing home, skilled nursing facility, extended care facility, another inpatient facility, rehabilitation, or subacute rehab. Okay, so if you look at each of those, you're going to have like your acute care hospital. These are like your most recently removed from an injury, and then they're going to go to like a rehab or subacute rehab, and then they would transition to a nursing home, skilled nursing facility, or extended care facility. So those are those type of settings. The patient's going to be staying there overnight. They're going to have therapy as a part of their treatment plan. They may get intensive therapy between PT, OT, and speech language pathology in these different settings. Then you have outpatient settings where we go through and we talk about, again, the patient comes and then they leave. So you have a freestanding PT or hospital clinic. You have home health physical therapy, industrial or occupational health, a different outpatient facility. You have a school or a preschool, and then you could have a wellness, prevention, or a fitness-based physical therapy location. And then this is relatively newer. I think I didn't cover this in some of my other videos, more recent videos covering observation hours, but there's other settings where it's a non-clinical setting where you're able to observe or work with a physical therapist, okay? Attended PT sessions as a patient with a family member, observed a non-PT or PTA healthcare provider. Then you have Special Olympics volunteer hours, and then you have this HOSA Future Healthcare Professionals PT competitive event participant. And then other, which I'm not exactly sure if you've had some other type of non-clinical hours, which again that would go under observed non-PT or PTA healthcare provider, and you could just do multiple rounds of that. And then patient diagnoses or patients observed, you'd have general orthopedic, neurological, cardiovascular, pulmonary, integumentary, geriatrics, pediatrics, sports, aquatics, women's health. And you would click those different boxes within there to let them know the type of patient populations that you observed or diagnoses that you're working with. So I hope this is helpful in terms of these are the different types of settings that are available to you. There are so many different settings. If you live in a more metropolitan area or a larger city, you're likely going to have more availability to all of these different areas. If you live in a more rural community, chances are you're going to have more limited availability, but you also may have physical therapy locations where they are kind of treating a little bit of everything, right? So maybe they're in the inpatient setting, and that therapist that you follow, maybe they're in the ICU or the acute care, and then they float over to a rehab hospital, or their outpatient PT clinic sees neuro patients and orthopedic patients, versus in larger metropolitan areas, you kind of have a breakdown of more specialization as far as that goes. And we've talked about this before. The best ways to get involved is to get your network of physical therapists built up. If you don't have a network of physical therapists where you can ask, hey, do you know where I could observe someone who is a physical therapist in home health? Do you know where I could observe someone who's a physical therapist in pediatrics? The PT world is pretty small, and once you get into the PT world, you can start asking people if they have connections that can get you hooked up into different settings. A lot of times, what's hard for applicants is getting into that first setting and getting those first initial experiences. This is why we highly recommend that you get involved with your local pre-PT club and you start networking and asking them, hey, where, go participate, be a part of the club, show that you're going to be there, that you're going to contribute, and then ask if they have a member of their club leadership that is responsible for helping people get lined up with observation hours. That's always an important part of it. Any good pre-PT club should be able to point you to places that are more willing to accept students or that look for students, whether it's working as a volunteer or it's working as a tech. Either way, any good pre-PT club is going to be involved in that because that is an important part of getting into this profession. So I hope this has been helpful for you. If you have tip requests like this one, go ahead and submit them to us via our Instagram story on Tip Request Tuesday, and we look forward to answering your questions in the future. Thanks so much, and have an awesome start to your week. Take care.